When managing type 2 diabetes, knowing the guidelines can make the difference between slowing down or preventing complications, or more and more medications being added on. Most of the physicians that I work with stress the importance of knowing the guidelines with their patients. And the guidelines continue to change and get stricter over the years as we learn more and more about diabetes. Diabetes is an age accelerator. It takes away our vital years. By controlling it, we can add years and even decades to our productive years, which can allow us to be around to watch our grandchildren grow up. Type 2 diabetes is characterized by two core defects: insulin resistance and beta cell dysfunction. Both of these can result in high uncontrolled blood sugar. Insulin resistance generally means your cells are resistant to insulin, so they can't get the sugar that they need for energy. Beta cell dysfunction generally means that the cells of the pancreas that are responsible for creating and releasing insulin aren't working properly. High blood sugar can result in microvascular and macrovascular complications. Microvascular refers to damage to the small blood vessels, and macrovascular refers to damage to the large vessels. Macrovascular complications include dyslipidemia, which means cholesterol abnormalities; hypertension, which refers to high blood pressure; atherosclerosis, which means plaque, cholesterol deposits in your arteries that result in narrowing of your arteries; coronary artery disease, this means blockage of the arteries that supply blood to the heart, which results in heart attack. Cardiovascular events, such as heart attack and stroke, account for 80% of all deaths for people with diabetes. Microvascular complications include damage to the eyes, kidneys, and feet. Diabetes is the leading cause of blindness, kidney failure, and amputations. Here's some good information, terms and guidelines to know and be familiar with if you aren't already. Fasting blood glucose, or fasting plasma glucose. This is a measurement of glucose levels after fasting for at least 8 hours. Normal fasting is less than 100 milligrams per deciliter. Postprandial blood glucose, or postprandial plasma glucose. This is the measurement of glucose levels after a meal. In the beginning, postprandial glucose control is the problem with newly diagnosed type 2 diabetics. This is usually the earliest sign of problems with blood sugar. A1C. This tests your average blood sugar levels over a 2 to 3 month period. The American Diabetes Association A1C target is less than 7%. Normal ranges are between 4% and 6% for an A1C test. One thing you should know is that type 2 diabetics who have pretty good glucose control usually should focus on their postprandial, or after a meal, glucose levels. While people who are poorly controlled overall usually have higher A1C levels and should focus more on fasting levels. The bottom line with type 2 diabetes is you have to get and keep your blood sugar around normal levels to prevent the complications that come from having high blood sugar. Prior to using any of this material, please consult with your physician. For more information on controlling type 2 diabetes naturally, visit my website, diabetesdietcures.net, now.